So we arrive at a scene where a 40-year-old male has fallen off a tree. The dangers around us was a saw, but that's being put to the side. There are no other visible dangers, no dogs and no bystanders. We've got our PPE here, we've got our boots and our gloves. We do not have our glasses, but we know that in real life situations, it's a must to have glasses. I can see that the patient has a laceration to the left arm and a right angulated ankle. At this moment I cannot tell that the arm is a venous bleed or an arterial bleed, but that we will determine later. I can also say that the patient looks like the patient has a injury to the neck as well. The patient's lying on the grass, so it's hard to tell if there's any blood loss, but we will determine that later as well. Do you think it's safe to enter?
Yes.
Hi there, sir. What's your name?
Ash.
So my name is Ekta and that's Sonia, and we are from the ambulance and we're here to help you. So I can see that you've got a cut to your hand. Can you tell me what happened?
I was getting some tree branch and I fell off.
So while I bandage up your hand, Sonia here is going to take some vitals. So she's going to take your blood pressure, your respiratory rate and heart rate. Sonia, are you able to do that, please? So while Sonia is doing the vitals, I'm going to be cleaning the wound and getting them. So I'll be using saline on the wound.
Can I put this around your arm?
Yeah.
And onto the compound dressing. And then I'm going to place it onto the wound, applying pressure. So the first layer of the bandage, make sure that it's nice and tight. And then making twists along the way on top of the wound for added pressure. So feel your pulse. And out of the arm. So when applying the first bandage, the bleeding did not stop. So in this case, I will apply a second bandage. This time I won't be using saline because we're not touching the superficial wound. It's just on top of the previous bandage. So again, I'll apply the compound dressing. And dress this exactly the same way as the first. So the base layer, nice and tight. Making twists along the way in the second one. Just on top of the wound. And we'll tuck that one in. Take the pulse again. Cool. And we'll just elevate the arm. Okay, Sonia, can you please let me know the vitals?
The blood pressure was 118/180.
Yep.
Heart rate was 70 beats per minute.
Yep.
And the respiratory rate was 15 beats per minute.
Cool. So at the moment it looks stable overall. Can I get you to just come around here and just apply pressure to the wound, to the arm, while I complete a rapid trauma sweep. Okay, so I'll be conducting a rapid trauma sweep. Before that, I will gain consent from the patient. Okay, Ash, so I'm going to be examining you from head to toe. Is it alright if I can do that?
Yeah.
Okay, cool. So just on the cranium, looking for any abnormalities, forehead, the cheekbone, jawline again for any abnormalities, the neck.
Ouch.
Okay, so the patient has indicated that they have pain on the neck. Is that on the midline here?
Yeah.
So the pain is on the midline lateral to the spine. That could indicate that the patient has a suspected spine injury. So we will have to deal with that very quick. Coming along, can you tell me if you've got any pain here? Any pain along here?
No.
Any pain here?
No.
Just down the sternum, any pain here?
No.
Can you take a deep breath, please? And out. Any pain?
No.
Okay. Good chest rise there. Just palpitating on the abdomen. Looking for any tenderness or any internal organ damage. Just down the pelvis here. Again for any tenderness. Any pain here? Any pain here?
Ouch.
Okay, so the patient has indicated that there's pain down on his right ankle. So this could indicate a angulated ankle as suggested. So before I commence anything, I'll be going back just to ask Sonia how the bleeding is. How's the bleeding, Sonia?
Still bleeding.
Still bleeding? Okay, so I'll come around there. Okay, so what I'll do now is I'll sit here. I'll get you to come around. Could you just sit here and make sure that the neck is stable, please, and there's no movement. Cool. So what I'm going to do now is apply a tourniquet because the bleeding has not stopped. Before I apply the tourniquet, I'm going to offer the patient pain relief. So before giving pain relief, I will gain consent. Okay, Ash, so before I put on the tourniquet, would you like pain relief? Because it may be painful.
Yeah.
Yes, okay, so the patient has indicated that he would prefer pain relief. So I will be administrating, I would be giving methoxyfluoride. Okay. So here I have methoxyfluoride pain drops, 3 ml, and expiry is 2020. So I'll just get my officer Sonia to check that.
Penthrox, 3 mils, expiry 2020.
Cool. So what I'll do is I'll give that to my patient. Can I just grab your right hand, please? So hold on to this, and every time you're in pain, just blow in and out of this one, okay? And before that, I'll just ask you: have you ever had methoxy before?
No.
Do you think you've had it in the last week?
No.
And do you have a family history of malignant hypothermia?
No.
Any kidney problems?
No.
Okay, and any allergic to anything else?
No.
No. So just to be aware, there is some side effects. There's nausea, dizziness, and headaches. Okay.
Okay.
So what I'll do now is apply the tourniquet. So when applying the tourniquet, this must be 10 centimeters proximal from the wound, and it should be on a on a singular bone, not on the joint. Okay. So once the tourniquet has been applied, you'll have to twist this little handle here. In this case, I'm not going to twist it too far. Once finished, place it inside the slot here. and make sure that you record the time. This is so the hospital staff know when the tourniquet was applied. Once you've placed it, take a pulse again. So in this case, you should not feel a pulse. If you do, it means that there is blood circulation still and you need to apply a second tourniquet. AUT to Combs, can I have backup please for IV analgesia things? So make sure that you always call for backup. That's right. Okay. So once the tourniquet is applied, we'll elevate the arm and then remove the bandage to have a look at the wound. So as we can see now, the wound has stopped bleeding. What I'll do also is put on a new bandage just lightly, just so that the wound is clear from any dirt and debris and there's nothing that could infect the wound further. I'll just get a bandage and Ash, can you tell me what the pain rate is at the moment? 1 being the greatest and 10 being the worst.
8.
Okay, so it's about an 8 right now. Okay. So what I'll do now is apply a C collar to the neck for the suspected spine injury. Okay. So for the application of the C collar, you need to measure this out. So by measuring this, you'd place your fingers from the neck to the jawline. So that's about 3 fingers. So if you want to adjust the collar here, just pop the tabs out and you can adjust them and then pop them back in. Okay. So Sonia, when I say lift, I'll just get you to slightly lift Ash's head so I can slide the C collar down, okay? So ready, steady, lift. Okay. And there you go. Right. Is that alright, Ash?
Yep.
Can I have some towels from the bag, please? So I'll just be placing some towels next to the neck here, just to support the neck and spine, while Sonia here helps me out with the ankle. Right, Ash, can you tell me when I start, just if you can feel this?
Yeah.
So if you can feel it on this leg here
Yeah.
and this foot here?
Yeah.
Okay. Can you feel this here
Yeah.
and this?
Yeah.
Can you wriggle your toes for me, please? Cool. I can see that movement is good and the color seems to be normal. I'll take the pulse. Okay. So the pulse indicates that on the angulated foot it's a bit delayed compared to the other one. The capillary refill time again is a bit delayed on the angulated foot. Okay, can you just push against my palm, please? Great. Okay, Ash, so we are going to be splinting up your ankle here. I want you to take a deep breath of the methoxy before we do that, okay? Great. Okay, Sonia, so when I say lift, I'll just get you to bring the splint in and just place the bandages underneath the foot, okay? So ready, steady, lift. And place it. Great. So always remember that the splint is the right size and it's placed properly. And when we're tying up the splint up for security, make sure that it's above or below the wound. So in this case, we wouldn't be tying it on the wound because it could mean that we are placing more pressure and more pain onto the injury area. Okay, Ash, so can you once again tell me if you can feel this?
Yeah.
And if you can feel this?
Yeah.
Could you feel this?
Yeah.
And this?
Yeah.
Great, so I'll just take the pulse again. Pulse here. And the capillary refill time. Great, so what I can see here is that the pulse is, it has improved from the previous reading, and so it has the capillary refill time of about 2 seconds. Just see the color as well, and the color sensation, well, the color looks well as well. Ash, can you please now tell me what your pain rate is on a scale of 1 to 10, 1 being absolutely great and 10 being the worst?
5.
5, cool. So patient has stated that his pain is about 5 now, which has come down from 8. That indicates that the splinting and the C-collar has supported and relieved a bit of his pain. Okay, Ash, I'm just going to take the last vitals. The blood pressure cuff, please. Okay. So what I'll do is I'll take Ash's blood pressure first. Okay. So just grab your hand, your arm here, please, Ash. Great. So the blood pressure here is stable. It's telling us it's about 119 over 85. That's within the normal ranges. It should it's within the normal ranges. I'll just check the heartbeat, the heart and the lungs. So can you take a deep breath for me, please? In out. Stay here. In out. Deep breath in and out. And one more time, deep breath in and out. Great. So his lungs seem to be normal. Okay, Ash. Just one more question before we scoop you up. So are we administering some long-term pain relief to you? That would be paracetamol. Are you allergic to paracetamol? No. So our patient here has indicated that he's not allergic to paracetamol, which I will be giving to him for long-term medication once the methoxyflurane comes to an end. So I will be giving my patient liquid form of paracetamol. This is because he has a suspected C-spine injury and I cannot elevate or sit him up. Therefore, it's easier for the liquid substitute. I'll be giving him 20 mils as because he looks to be of 80 kilos. In this case, if he was to take tablets, I'd give him 2 tablets, 500 milligrams each. Again, just because of the weight of 80 kilos. Great. Okay, so we'll take you away now, yeah?
Okay.
So with my patient today, I have given him a GCS of 15. The reason being is because his eye response was great, his verbal response was great, and his motor response was great. He was cooperative and obeying commands. The other thing I would suggest in this scenario is that I will take a blood glucose level. This is because it could indicate that the patient had low blood sugar, therefore he had a fall. With the methoxyfluoride, some symptoms that could arise are headache, nausea, and dizziness. And another thing would be the lanyard that could be placed over the patient's collar to suggest the type of injury and how crucial the injury is.